Phentermine is a medication used very commonly for weight loss around the world. But how effective is it in practice, and what should you know before taking it? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. Although phentermine is not available in Canada, it seems to be pretty widely available outside of Canada, and many of my patients from around the world have experiences using the medication and use the medication themselves during their weight loss. So from their experiences, I'm here to shed some light into what you might expect and what you should know before you try it yourself. Phentermine is a medication with many brand names like Adipex, Duromine, Fastin, Lomaria, and many others. It's an amphetamine-like stimulant that has properties which cause appetite suppression. Its approved use for weight loss dates all the way back to 1959 and has a long history of use, having a good safety and efficacy profile compared to other weight loss drugs at the time. Since it's become generic, it's also relatively cheap, contributing to its popularity worldwide, as it's one of the most commonly used drugs for weight loss to date. How does it work? Phentermine works as an amphetamine-like appetite suppressant. Amphetamine stimulants work by stimulating the sympathetic nervous system, also known as the fight or flight nervous system. This system is normally activated during times of acute stress and prepares your body for fight or flight by getting your muscles ready to act. It also shuts down unnecessary systems in your body, like your digestive system. This shutdown results in a suppression of appetite. The stimulant effects of phentermine also help you to feel more awake, allowing you to remain more physically active and burn off more fat as a result. Side effects. Phentermine has a number of stimulant-related side effects like headaches, dizziness, tingling in your hands and feet, and heart palpitations. You should be regularly screened by your clinician to check your heart rate and blood pressure to make sure phentermine isn't going to cause more serious cardiovascular issues down the road. If you do have cardiovascular issues like a history of strokes, phentermine may not be appropriate for you to use. It can worsen anxiety in some people, so those with anxiety or mood disorders need to let their doctor know to see if it's appropriate for them to use. Sleep issues like insomnia seem to be pretty common, so most people end up taking phentermine earlier in the day, like mornings, to minimize sleep problems. Gastrointestinal issues are also common, such as nausea, constipation, or stomach pain. In addition to suppressing your appetite, it may also modify the mouthfeel of some foods by making your foods taste strange or different, or causing your mouth to feel very dry. It also interacts with a number of medications, particularly with other stimulant or mood medications. Let your prescribing doctor know if you're taking other drugs. Is it addictive? Phentermine is considered an amphetamine-like stimulant. Amphetamine stimulants have a long history of having addictive qualities, and being on amphetamines for long periods of time can increase one's dependence and cravings to continually use it. Interestingly, the addictive qualities of phentermine do not appear to be as strong as other amphetamines, and patients who use phentermine for longer periods of time are at less risk of developing a dependence or craving for the drug than, say, Adderall. So studies would suggest that while there is a potential risk of addiction since phentermine is like an amphetamine, it's not as addictive as straight-up amphetamines. From my experiences, there are definitely people who become addicted to phentermine. Patients report that it's related to feeling energetic and feeling great while on the drug, as well as having to stay on the drug to avoid weight regain. Discontinuing the drug can result in uncomfortable headaches, fatigue, and weight rebound in many people, particularly in patients who have taken phentermine for longer periods of time at larger doses. Can I drink alcohol on phentermine? It's not recommended. Alcohol can sometimes worsen some of phentermine's negative side effects when taken together, particularly if you have cardiovascular issues to begin with. Another concern is from patients using phentermine who may also be addicted to alcohol. Phentermine is a stimulant, and alcohol is a depressant. Because both have opposing effects, people who use them might need to consume more of both phentermine and alcohol to achieve the same effects. This means that these patients will need to take larger and larger doses over time. And because both phentermine and alcohol can be addictive, it significantly increases the addictiveness of both drugs and can make it harder for you to wean off both. Can I have coffee on phentermine? It's generally recommended you try not to take any other stimulants with phentermine, whether it be another stimulating drug like fluoxetine a stimulating supplement like ginseng, or a stimulating food like a highly caffeinated energy drink, since phentermine is already a stimulant, and adding more stimulation could worsen stimulant-related side effects like anxiety, restlessness, and insomnia. In practice, while it may be prudent to avoid the excessive intake of caffeine like from a Red Bull, a normal coffee or espresso per day is not likely going to cause issues in most people. Is it effective? Phentermine seems to be most effective in short-term weight loss. Many people who use it can expect anywhere from 5 to 10% weight loss in the first few months. The problem with phentermine, however, is that this weight loss is frequently not sustained. From my experiences, there are some patients that find phentermine stops working for them as quickly as just a few weeks of taking it. Weight loss tends to plateau, and in some cases rebound. Often, it occurs if a proper weight loss diet and good habits were not implemented. However, its effects of suppressing appetite do tend to diminish quickly over time. Also, some patients initially starting phentermine take the appetite suppression too far and will force themselves to eat almost nothing on their diet to lose weight more quickly. Unfortunately, this strategy is somewhat short-sighted. Extreme dieting increases your risks of weight rebound later on, especially when phentermine stops working. What to expect? Phentermine may be an option for you to help support weight loss, since it can produce effects quite quickly. However, understand that these effects on your appetite and weight are strongest in the first few weeks, and are likely to grow weaker over time. Many people increase their dose to counteract the weakening effects of phentermine. However, this only serves to delay the time when phentermine stops working for you. Additionally, increasing your dose increases your risk of becoming addicted to phentermine, making it even harder for you to eventually stop taking it. Also, if you start phentermine and are not losing weight, taking a higher dose is not likely going to help. Phentermine is also widely available outside of Canada, and generic phentermine is relatively cheap compared to other weight loss medications. It's for these reasons that some people who started taking phentermine end up taking it for years, even though they may no longer be losing weight on the drug. So if you really do decide to use phentermine, try to use it as a temporary support tool for short periods of time, aiming to come off of it and have your weight loss diet take over as soon as possible. You could also use it as needed, for example by taking a small maintenance dose during a vacation and discontinuing it afterwards. Developing and having a proper weight loss diet is imperative while on phentermine. Without one, rebound weight gain is almost a certainty. If you're interested in the type of protocol we use for our weight loss patients, check out our online weight loss program in the description below. Do you have experiences with phentermine? Let me know in the comments down below. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know who can use the help.